Okay, we finished up our previous talk just covering the different shapes of teeth. And as you can see here, we have some images of both the baby teeth and the adult teeth. One thing, if you're into CSI or anything like that, these teeth do come in at a fairly predictable rate. So it is pretty easy if you have a body that does not have all of its teeth in yet to tell exactly what the age the person is. If they had their 12-year molars in but didn't have their wisdom teeth, then we would know that that person is somewhere between 13 and 17. And by the same token, if they had didn't have their 6-year molars in yet, we would know that they were under 6 or at under 7 anyway. So that is some use there. Beyond that, just some of the regions of the tooth and structures, a couple of things that I want you to know. The part of the tooth that is exposed is the crown. And that part, the visible portion, is made of enamel, which is the hardest substance in the human body. Enamel is enormously hard. Um, if any of you like to crunch ice, there is a measure of hardness of substances, and ice compares to the same hardness as concrete. So when you're crunching on ice, you could just as easily be chewing on a piece of your driveway. Um, and your teeth are that strong. They will survive that. Um, so it is a very hard substance. They will survive provided that their tooth has not been compromised, I should say, with a filling or decay or something like that. Now, underneath that is dentin. And dentin is the second hardest material in the human body. It is hard enough that we can push a root around when we're trying to extract a tooth and we're actually expanding the bone to allow us to take the tooth out. Running in the middle of the dentin is an area called the pulp cavity, which contains not just nervous tissue, we think of that as the nerve, but blood vessels, and it feeds some cells which help maintain the life of the tooth. Once the pulp is dead, or if you've had a root canal, these maintenance cells are gone, and the teeth tend to dry out a little bit and become more brittle and are more susceptible to breakage. So that's what happens when you have root canal therapy. Now, the root canal itself is just where the pulp lives. Now, I don't care about the neck. There's really not a term that is used that much in dentistry. But the root, it is coated with a substance called cementum. And there are little fibers that run from the cementum to the bone that support the tooth in kind of a sling. The tooth actually hangs in this hammock-like structure, which is a ligament. And just like any other ligament, you can tear or stretch it, and you can have tenderness. You may have, at some point in time, bitten down on a popcorn kernel, and for a few days later, the tooth is just touchy. And it would be the same thing as if you twisted your ankle. Um, so there's probably no permanent damage there. The ligament, referred to as the periodontal ligament, and the sometimes periodontal membrane is used as well. The actual name for this type of joint, uh, which I just love the name, is a gomphosis. Now, that's all I'm going to ask about on teeth. You just don't know how much that pains me being a dentist, but that's as much as you need to know. Now, salivary glands. Salivary glands are also very important, and we have three pair of salivary glands. We have the parotid gland, and the submandibular gland, and the sublingual gland. Named for their locations, the parotid glands are located on the side of your face, up here, and actually swing a little bit under your lower jaw. If you take your tongue and feel up on your cheek, kind of by your um, second molar, you might find a little bump there, and that's the opening for the parotid gland. You can rub your cheeks and actually stimulate the parotid glands and squirt saliva out. The saliva made by the parotid gland is very runny. This is the gland, too, that gets impacted when someone has mumps. The submandibular glands are along the lower jaw, and the sublingual glands are under the tongue. And these both produce a slightly thicker, more mucousy type of saliva, and it's a mixture of the mucus and the serous saliva that you're most familiar with. However, as we age, the parotid glands tend to decrease in efficiency and produce less and less of the serous fluid, while the submandibular and sublingual glands will continue to make this mucousy stuff. So you sometimes see older folks with thick, ropey spit in the corners of their mouths, and this also impacts their ability to taste because they need a more liquid kind of saliva for stuff to go into and down to the taste buds. So, saliva itself is a mixture of mucus and serous fluids. It does a couple of things. It helps form the food into a bowl or bolus that we can swallow. It does have an enzyme in it called salivary amylase, which is like the pancreatic amylase released in the pancreas. This initiates the breakdown of starchy foods. Now, as soon as you swallow these starchy foods and it gets into the stomach, the acid immobilizes or inactivates the salivary amylase. So if I ask where carbohydrate digestion is done, I'm talking about the small intestine. It does begin in the mouth. The purpose here, if you started getting weak and shaky, you could put a cracker, piece of candy in your mouth, and as long as you didn't swallow it, that amylase would break that down, and the tissues are thin enough in the mouth that some of that sugar could be absorbed into your bloodstream and boost your energy level back up. The thing is, you don't want to swallow it if your energy is tanking. Anyway, saliva also dissolves the chemicals, which allows them to run down into. Sorry, that was a phone call. So it dissolves chemicals so they can be tasted. Now, the pancreas, this is our next accessory organ, and it is posterior to the peritoneum. It extends across the abdomen near the stomach, and excuse me, spleen to the duodenum. And let's take a look at what it does. First off, the pancreas makes what we call digestive juice. It's just a wide spectrum of enzymes. There's amylase that breaks down sugars, lipase that breaks down fats, proteases that break down protein, and this fluid is also basic in nature, which helps neutralize the acidity coming from the stomach. Beyond that, it produces two hormones. Insulin, which is produced by beta cells within the islets of Langerhans, and glucagon, which is made by alpha cells in the islets of Langerhans. Now, insulin is secreted when we have a high level of blood sugar, and it allows the sugar to be taken in to the tissues where it can be used. Glucagon is secreted when we have low levels of blood sugar, and it causes the liver to release sugars that it has stored in release sugars that it has stored. The location of the pancreas, as you can see, kind of under the stomach, close to the pyloric valve. So, the relationship of the pancreas to the gallbladder is an important one. The gallbladder holds bile, which is made by the liver, and there is a bile duct which joins up with the pancreatic duct to form this hepatopancreatic duct. What happens is that the liver makes bile, and the bile flows down, and when this is plugged up, when the sphincter is closed, just prior to the common bile duct, bile backs back up, flows into the gallbladder, and is stored for later use. Sometimes you can have bile that makes it into these pancreatic ducts, and in situations like that, you can develop a pancreatitis, which is quite painful. Now, speaking of bile, uh, it is made by the liver. The liver is the largest gland in the body. It is located on the right side of the body under the diaphragm, and it really is huge. Consists of 4 lobes suspended from the diaphragm. You don't need to know how many lobes we have, but it's connected to the gallbladder via the common hepatic duct. Now, there's your liver, there's your stomach, and the gallbladder is a little green structure there. The product it makes, among other things, the liver has about 400 different functions, or I'm sorry, 40 different functions. One is to produce bile, and that consists of bile salts, bile pigments, which mostly bilirubin from the breakdown of hemoglobin, cholesterol, phospholipids, and electrolytes. Bile acts as a surfactant. That is, it's like soap. It gets in between bits of fat and emulsifies them, and that allows better absorption of the fat into the lacteals. It is a mechanical type of digestion that occurs from the bile. Bile is also basic in nature, so it helps neutralize the acidity of the kind coming out of the stomach also. Bile, you can reduce your blood cholesterol level by eating certain foods, basically soluble carbohydrates, soluble fiber that will bind to the bile and carry it out of the bloodstream. And then the liver will have to take cholesterol from the bloodstream to make more bile, thus lowering your overall blood cholesterol level. Know then that bile salts are for breaking down fats, and if you have your gallbladder removed, there can be problems in terms of eating fatty foods. You may not be able to do it anymore. People also have problems with spicy foods when they have their gallbladder removed, because the spice is capsaicin, which is a wax, which also requires assistance in being broken down. The gallbladder itself is a sac found by the liver, and when there isn't any digestion, we just store the bile. One of the problems that can occur is that the cholesterol salts can form crystals, and then you have gallstones, which will pass down these small pathways. They can be quite painful. You can also have significant pain just because of the blockages that they occur and the pressure that builds up. And with that, we have covered all of the issues of the digestive system. I hope that this is helpful. So thank you very much.